Hey, this is Ansley Smith, and today I'm going to be performing my neuromuscular exam. This is my volunteer, JJ. I'm going to start the exam by examining the 12 cranial nerves. I'm going to do some different tests, and then I'm going to end the exam by checking some of the reflexes. So the first thing we're going to do is check cranial nerve 1, which is the olfactory, which has to do with your sense of smell. And I'm going to get her to close her eyes. I'm going to get her to take one finger and close one side of her nose. And get you to sniff. Can you tell me what you think that is?
Oh, red or green?
Yes, okay. Same thing, keep your eyes closed. Do the same thing to the other side of your nose. Okay.
Alcohol.
Yes. Okay, that's good. Alright, next we're going to check 2, 3, 4, and 6, which is particular to the vision. So what I'm going to do is I'm going to check with the light, check for corneal reflex, going to check to see if the pupils constrict. I'm going to do extraocular movement and a couple other things. I'm going to use the vision chart, and that's how I'm going to test those. So the first thing I'm going to do is check, make sure. Okay, and that's good. Next thing I want you to do is follow my finger. Then I'm going to take this chart. This is the Rosenbaum chart. I'm going to hold it about 14 inches in front of her face. I'm going to get her to cover her right eye first and let her tell me where she can read to.
63925 ME backwards E XOX.
Okay, that's good. Do the same thing with the other eye.
63925 ME backwards E XOX.
Okay, very good. The next thing I'm going to do is I'm going to check for the cranial nerve 5, which is trigeminal. In this particular case, I'm going to just stay on the right side of her face because she actually currently has been diagnosed with trigeminal neuralgia and she's having some issues on her left side, so we're just going to focus on the right side. What I'm going to do is I'm going to use the end of a gym clip first, and then I'm going to use a cotton swab. She will keep her eyes closed. The purpose of this, I'm going to do it in about 6 areas, is they should be able to feel each prick or each wisp in case of the cotton, and if not, then that could mean that there's some sort of issues in the trigeminal area. Close your eyes for me. Did you feel all of those?
Mm-hmm.
Did you count 6?
I did.
Okay. Got that? One other thing you can do to check the corneal reflex is to take like a cotton swab or a Q-tip or something and just at the very corner of the eye, brush it across it. They should blink simultaneously with both eyes. However, if you wear contacts lens, sometimes that doesn't happen. So for this, we're going to do this. Okay, that's good. All right. The next thing we're going to do, we're going to check 7. So what I want you to do, I want you to smile real big for me. I want you to frown. I want you to puff your cheeks. Okay? Oh, that looks really, really good. Last thing, try to wrinkle your forehead for me. Okay? That's good. All right, the next thing we're going to do is cranial nerve 8, which is the acoustic. I'm going to perform the whisper test, and I'm also going to perform the Weber and Wren test. Okay, so I want you to cover this ear. Tell me what I say.
99.
Okay, same thing with
99.
Okay. Okay, I want you to tell me. Can you hear this on both sides?
Yes.
Okay. Tell me when you cannot hear it.
Okay.
Okay. Same thing on this side.
Okay.
Okay, that's good. All right. 9 and 10, I'm going to get the patient to swallow. I'm going to check her gag reflex. I'm going to make sure that her uvula is midline and that there's no hoarseness noted in her voice, and there has not been any. We also performed a test prior to that was a little bit more in depth for my write-up. So for this particular case, I'm just going to get you to stick your tongue out for me. I'm going to get you to say, ah. Okay, I'm going to look. Her uvula is midline. Everything looks good there. No problems with her voice. Cranial nerve 11, I'm going to get you to shrug your shoulders. Okay, and then I'm going to put pressure here, and I want you to try to continue to shrug. Okay, right, that's good there. And then the last one is cranial nerve 12. I'm going to get you to stick your tongue out, and I want you to move it from side to side. Okay, all right, all that looks good. So all her cranial nerves are intact, and I see no problems with those. So the next part of my exam, I'm going to perform, or the reflexes, I'm going to do the bicep reflex, the tricep reflex, the brachioradial, the patellar, the Achilles, and the last part of my exam, I'm going to check and see if she has a Babinski sign, which should be negative. You do not want this to be positive. That could be a bad sign. And what you're looking for with that is dorsiflexing of the big toe. So the first one I'm going to do, this is the brachioradial. Okay, that's good. This is the patellar. Okay, that was good. Right, this is the Achilles. And make sure you apply a little bit of pressure to the foot when you check this. Okay, that's good. Okay, and then the last one is the Babinski's, and it kind of, especially if somebody's really ticklish, to be careful with this. You just kind of slowly go around this part, and like I said, what you're looking for, you want it to be negative, so there should be nothing. If it's positive, like I said, that could be a sign that there's something else going on. Reflexes are good, cranial nerves are all intact, and this completes my neuromuscular assessment.